And thanks for joining us on this special live presentation on the WMAR2 News Facebook page along with Gbmc. And today we're talking about the comprehensive weight loss program at Gbmc and bariatric surgery, to be specific. I'm talking with Emily Waters, a surgeon there at the Comprehensive Center for Weight Loss at Gbmc. Dr. Waters, thanks so much for joining us this morning.
Oh, thanks for having me.
Well, it's such an interesting field, Dr. Waters, and I have to assume, and correct me if I'm wrong, it seems like it's grown and it's become more common over the past several years and even the past couple of decades.
Yes, definitely. As the obesity epidemic has grown in the United States, we have more need for bariatric surgeons and bariatric surgery. So it definitely has grown exponentially.
It does seem like an option that could come after other options have been explored. Is that correct?
Yes, definitely. You definitely want to try medical weight loss. We encourage people to see their primary care physician so that they can get into either a nutrition program, start an exercise program. There are definitely a lot of options to help with weight loss prior to bariatric surgery. And we consider bariatric surgery a tool in the toolkit for weight loss.
And if anyone has any questions watching this morning, feel free to forward those to us and we'll get those answered for you. But just a very interesting topic this morning, bariatric surgery at Gbmc. And Dr. Waters, has it gotten easier for patients? Is it less invasive or a more simple kind of surgery than it once was? Or is it still considered a major surgery that needs to be really thought about and considered before going through with it?
Any surgery, I have to say, is a major surgery. So don't take any surgery lightly, but it definitely has, over the past 20 years, become more minimally invasive. That means it's small incisions, less than a centimeter. The patients usually stay only one night and go home the next day. You're walking the day of surgery, able to drink liquids. So it's definitely not as invasive as it used to be. But I always caution anybody who undergoes surgery, don't take it lightly. But you're right, it's all done laparoscopic, or we're doing robotics too, starting in July. So it is definitely come a long ways.
Dr. Waters, is there a typical time that a person or a patient might be in contact with the center there, potentially trying other programs, including diet and exercise and everything else? Is there a certain time when it becomes clear that the bariatric surgery is a appropriate option for a patient, or does it just depend on the patient's situation?
There's definitely some criteria that we look for. So if your BMI is over 40, or if your BMI is over 35 and you have a comorbidity such as high blood pressure, diabetes, sleep apnea, that's when we say definitely come see us. And BMI, just for everyone out there, it's a combination of your height and weight. There's plenty of BMI calculators online, so you just plug in your height and weight, and that'll let you know where your BMI range is.
But I just think it's interesting when people, maybe they think they might eventually want to get this type of surgery, but it doesn't seem like you just come and get it right away.
No, definitely not. It's not a come see us and then we sign you up for surgery the next day. It's more of a process. That's why here at Gbmc, we have a comprehensive program. So you'll meet with us. One of the surgeons will go through all the information about surgery itself, and then we'll get you into our program. What that includes is you'll be meeting with our nutritionist, Jana, once a month to learn about nutrition. That's basically our nutrition education. You'll also meet with a therapist or psychologist to get cleared for your mental health. And then also we send you back to your primary care physician so that they can clear you medically. So there's a lot of different arms to this process.
Can you talk a little bit about, because I'm not sure if people would consider that, but it is interesting that there's going to be changes in diet even before the surgery was to happen. I mean, they're not going to, if they have to make some changes, they have to make the changes in order to get the surgery.
Yes, definitely. It's not, can be a common misconception, is that I just get surgery and I don't change my lifestyle at all. That's not how this works. You have to change your lifestyle. You have to change your mindset. It's a whole holistic approach. So before you go to surgery, you will be meeting with the nutritionist, and she'll go over all the diet changes. She'll review what you're going over and what you're eating now versus what you'll be eating in the future. And so it is definitely a comprehensive change that you'll be making to your lifestyle.
Can you just talk without, I don't know how in depth you want to get in terms of the viewers watching the discussion this morning, but can you just talk about exactly what goes on in this type of surgery? What do you do, and what does it change in a person?
Sure. This is my favorite part, is the surgery part. So there's two surgeries that we do at GBMC. One is the sleeve gastrectomy, and the second is the gastric bypass. So the sleeve gastrectomy is where you take your normal stomach. It's probably a little less than the size of a football, and we staple across it. So we make it more of like a hose, like a lot skinnier. So we take out about 80% of the stomach, take it out, send it to pathology, it's gone. So what that does is it not only restricts how much you eat, but there's a lot of gastrointestinal hormone changes that take place. So that's the sleeve. Then we have the bypass, which I like to call, it's a rearranging of the intestines. We don't take anything out, everything stays in the body, but we make a pouch from your stomach, pretty small, about 30 cc's, and then we connect your intestines, a piece of your small intestines. It's a little bit of a rerouting of the intestines, so food flows differently. So it used to be when these surgeries came out that they thought, okay, the sleeve is restrictive because you can't eat as much, and the gastric bypass, you bypass a lot of your intestines so you don't absorb as much, so it's malabsorptive. Now we know that it's so much more complicated than that. There's so many hormonal changes that take place, including hormones that tell you whether you're full or whether you're hungry. It's very complicated in all how that works. So it's much more than just changing your anatomy, which is, to me, it's just mind-blowing.
It's absolutely fascinating, and I wonder how you go about making the decision as to which of the two surgeries wound up being used in a patient.
Yeah, that's a great question, because for the most part, the surgeries are pretty similar in the number of cuts you get. They're 5 small incisions, all done minimally invasive, and the time you spend in the hospital. It's usually 1 night for both surgeries. So when I meet a patient for first time, there are certain things I want to know. Do you have acid reflux? Do you have diabetes? Those are the main things that help me determine one way or the other. If you have acid reflux, the sleeve is not a great option because it can increase your acid reflux. So for that, I would recommend the bypass. However, and if you have diabetes, I also recommend the bypass because it's about 80% of people who have diabetes and undergo the bypass are off their insulin, which is amazing. We have nothing else like that to treat diabetes. So if you have diabetes, definitely the bypass is the way to go.
And just talk a little bit about the effectiveness. Like, in other words, the patients you've seen and the research that you've seen after the surgery, along with the continuum of treating and staying with the patient in terms of nutrition and their psychological mindset and everything else. How effective is bariatric surgery?
It's very effective. It's the most effective and sustainable approach we have for weight loss. So it is very effective. That's why we spend so much time in the preoperative period, the 6 months of nutrition classes, all that. So patients who really get it and make those lifestyle changes and have bariatric surgery, those patients have the best success, and it's sustainable.
Yeah, and how quickly? I mean, do they start to? If you go from somebody with a BMI of 40% is pretty high. Does that start to come down over a period of many months after that?
Definitely. Usually within 2 weeks to a month, you really start seeing the weight drop. And that's another benefit of bariatric surgery. I have patients who I meet who say, well, can I do this on my own? Can I do it with medical weight loss? I say, absolutely. Like, let's try that. But the benefit of bariatric surgery is it really jumpstarts your weight loss. So you'll lose a lot of weight in the first couple of months versus a slower weight loss process. So that's not to say don't try medical weight loss. I'm always for that. And that's what those 6 months before surgery are for. But the bariatric surgery really jumpstarts it.
You really got to feel for some people too who've struggled with this issue, in some cases years, maybe even decades. And they finally want to get to a point where, look, they need to address this health issue, which winds up impacting many other aspects of their health. It just sounds like some people are finally coming to terms with the fact that they really need to do something for themselves and for their families.
Right. And we see most patients have tried on average 20 diets before they come to us. That's amazing. It's not like people aren't trying to lose weight. That's a huge point I want to get across. These people who are struggle with obesity, it's a disease. It's a chronic disease. So it's not that people aren't trying. It just is very hard to lose weight, especially when you get to the higher BMI, like in the 35 and 40 ranges.
Right. Melody has a question, and I'm going to read it to you because I'm not sure if I quite understand it, but I'm going to leave it up to you as the surgeon. Do you suggest a revision if you're diagnosed with GERD, Gerd, after surgery, especially if your weight is in the 134 range? What are your thoughts on Melody's question?
Okay. So I'm assuming that she had the sleeve before. So like I said, the sleeve can increase acid reflux, and GERD is another name for acid reflux. So yes, if you're struggling with acid reflux, it's not controlled on medications, then I do recommend a revision. So what that revision is when we convert a sleeve to a bypass. So I know there's some concern that, well, won't I lose more weight when I have the revision? But there's certain things that we do in the surgery. I don't want to get too technical, but the intestinal length we make a little bit different so that you won't have as much weight loss as if you were, instead of if you were going for the surgery with the intention of weight loss. So this is a little different. You're not going for weight loss. You're going to fix the acid reflux.
Yeah. So my mindset would be, if I go through with the major surgery and go through it all, I would really hope to not have to go back and do something else again in the future. But you're saying actually that does happen from time to time, and it's not the end of the world. It can happen.
Yeah, it does happen. That's why when we meet you, when the physicians meet you, we really ask a lot of questions about acid reflux. Make sure you're not on a proton pump inhibitor, any medications for acid reflux. If you are, and you're still really want the sleeve, I usually do a couple of studies to demonstrate whether you have bad acid reflux or whatnot. But yeah, it is possible after getting the sleeve to develop reflux and then need a revision.
And it sounds like if you were willing to go back in and do more with it, the acid reflux could be an issue that's really affecting someone in order for them to want to address that.
Yes. Yes. And then if you do develop acid reflux, we try the medication route first. We see if that works, some diet modification. And then after about 6 months, if that doesn't work, then we would say, okay, it's time to do a revision.
Can you talk a bit briefly about what else happens after the surgery? In other words, if someone does start to lose large amounts of weight as expected, do you notice the improvements in those other health statistics? I mean, do they get actually healthier? It's not just the loss of the weight.
Oh, definitely. That's what I love about bariatric surgery and about this, just about this specialty, is that it's not cosmetic. I think that could be a misconception, but bariatric surgery really gets to the core of someone's health. It's about your BMI. So people will improve in other chronic conditions. So we see a lot of people who come to us with chronic pain. So fibromyalgia, knee pain, joint pain, and that greatly improves after weight loss. Like I mentioned before, diabetes, high blood pressure. People get off their high blood pressure medications, sleep apnea. It affects so many areas of a person's life. Not only the health benefits, but also the emotional benefits. Like now I'm more mobile. I can play with my kids. I can travel more easily. There's so many ways it benefits a person's life.
Would you expect a patient to stay with the nutrition advice and even the psychological advice and handling for a period of many years after, or does that kind of fade away at some point, or is it beneficial just to keep doing that?
It is always beneficial, but usually after a time period, after probably the first year after bariatric surgery, you can start to back off it. And then there's always times where, okay, I've noticed I've gained a little weight. I want to go back to a nutritionist. That's always welcome. But we really try to focus on educating our patients before surgery so that they are empowered and have the tools to know about their nutrition, to take ownership of it, so that it doesn't have to be a lifelong thing. It can be, absolutely, but it doesn't have to be.
I wonder if you ever deal with the issue of family members of the patient. In other words, there might be a patient who isn't quite ready to go through with all this, but they might have family members who are concerned about them. Is there a way to kind of help get a family through that situation?
Yeah, that's always a tough situation because some people aren't ready to admit that they need help or aren't ready to seek bariatric surgery. So to me, I say, just love that person along. Don't be very forceful with it. Don't try to drop hints like, oh, you should eat this or that, but maybe bring, oh, I saw this. Oh, I saw this Facebook Live about bariatric surgery. I thought it was really interesting. So do it in more of a positive way and sharing examples or experience sharing about what you've seen or heard from other people in regards to bariatric surgery.
It really is interesting what we've seen in terms of obesity over the past couple of decades. It really does seem like there's a lot of unhealthy eating options that a lot of people take advantage of a lot of the time. I'm not sure if there's a number on, has it gotten worse over the past years, but it certainly appears to have gotten to the point where a lot of people have that issue, more so maybe than in previous decades.
Yeah, I don't have a statistic on it either. I wish I did, but especially with COVID, I've heard a lot of people who come see me and they say, oh, I just gained so much weight during COVID, or the COVID-19 pounds, that they gained. So definitely it's not a problem that's getting better, unfortunately.
Mm-hmm. And now it's not just the health aspects too that we talked about earlier. You've actually seen patients afterwards actually become more active in their lives and be able to do more things with what winds up being essentially a new body for them.
Yes. Yeah. And that to me is what's so exciting, is people actually living their life more fully, being able to do the things that they've always wanted to do and do it with more ease. To me, that's what brings me a lot of joy about this surgery.
And if people do have concerns about it, what can they do, and what would you tell them as they're starting to mull over the option of entering the program or going through with this?
So there's a lot of great resources out there. There's a ASMBS it's the certification, the board for bariatric surgery, but they have a page just for bariatric patients. So I really recommend looking online. There's so many resources, from credible resources to look into bariatric surgery, and then schedule an appointment with us. If your BMI is 35 or greater than that, you can go to our website, gbmc.org/weight loss. And you can sign up to meet with one of the physicians and learn more about it. We will also be at the Be More Healthy Expo on March 26th at Baltimore Convention Center. So myself and the other physicians and some of our staff from the office will be there. So come by, ask us your questions. We'd be happy to meet with you.
Yeah, and again, just to reiterate, not everybody that goes into the program winds up getting surgery. There are potentially other options that they can work through for a while before they start to look down that road.
Absolutely. I had a patient last week that I met with, and he was kind of borderline with his BMI. And he goes, I really think I could do this with just nutrition. And I said, let's get you in the program. Let's see how it goes. And that would be fantastic. If you lost the weight that you're happy with, then I'm happy for you. My goal isn't to get patients from the front door to surgery. It's to get them to a healthy weight where they're comfortable, where they're living their best life. So yeah, exactly. If people join our program and they're able to lose weight with nutrition, exercise, that's fantastic.
Okay, we're going to leave it there. Dr. Emily Waters is a bariatric surgeon with the Comprehensive Obesity Management Program at Gbmc. Dr. Waters, learned a lot today. Thanks so much for speaking with us.
Thank you, Christian.
And thanks for watching. Have a great day.